Yesterday, the location was Grand Junction, Colorado.
These struggles have always boiled down to a contest between hope and fear. It was true when Social Security was born. It was true when Medicare was created. It's true in today's debate.
For the third time in 5 days, Barack Obama used the presidential bully pulpit on behalf of what he's now calling health insurance reform. No more letting the angry opposition control the agenda.
They're Marxists, they're socialists.
Pure government takeover. I am definitely...
Here's a question. Do they even know what's in the bills currently being considered by Congress? Do you?
For all the chatter and the yelling and the shouting and the noise, what you need to know is this. If you don't have health insurance, you will finally have quality, affordable options once we pass reform.
Right now, though, reform is a moving target, still changing. There is no such thing as an Obama bill. The president presented a wish list to Congress where 5 different committees, 3 in the House and 2 in the Senate, are in various stages of drafting bills, with some big differences, but a lot of similarities.
All agree that all Americans should be covered. They all agree that you cannot be denied coverage because of a pre-existing condition.
Ralph Neese is CEO of the National Coalition on Healthcare, a nonpartisan alliance of groups working for healthcare reform.
They all agree that if you leave a job, you don't lose healthcare coverage. They all agree if you have healthcare coverage, you can't be denied it once you get sick.
And they would mandate that all but the smallest employers would have to provide insurance to their workers.
Jonathan Oberlander teaches health policy and management at the University of North Carolina, Chapel Hill.
The second thing that they would do is create a new marketplace where the uninsured and small businesses could go to get insurance. It would be called a health insurance exchange. And if you didn't have insurance from your employer, you would get subsidies from the government, and you would go to this exchange and you could choose what insurance plan you would have.
And each of the proposals would expand Medicaid. Where there's disagreement is over how all of this would be paid for, and over the so-called public option, a government-run health care plan that would be available alongside private plans.
Nobody tells me how to live my life.
The public option is by no means a done deal.
I don't want this country turning into Russia, turning into a socialized country.
But tell that to the people doing all the yelling at town hall meetings last week.
We are not moving to socialism.
And the reason they oppose the public option is they think it's a stalking horse. They think the real plan of President Obama, or those who want health care reform, is to have single-payer, totally government-run health care reform. It will fail if people think it is tilted to kill the private insurance industry.
We don't need Obama and his crew to tell us how to die.
And now to address some of healthcare reform's hottest hot-button issues, such as the reference to a death panel on Sarah Palin's Facebook page.
You would have a greater chance of being killed by a Death Star in one of these Star Wars movies than you would being killed by a government-run death panel, which is to say, they don't exist.
What is your position on taxpayer-funded abortion?
Hot-button issue number 2, abortion.
To the contrary, there is language in the House Energy and Commerce bill that says federal monies cannot be used for abortions.
For seniors, this will mean long waits for care, cuts to MRIs, CAT
and those television ads aimed at the elderly?
Seniors may lose their own doctors.
That is absolutely false. In fact, the opposite is true. This legislation is absolutely good for seniors.
The United States spends twice as much as the average of all the industrialized countries in the world. 1/2 of all the foreclosures, 1/2 of all the bankruptcies are because people can't pay their medical bills. And it's because of the broken system that we have.
The American public agrees.
Our most recent poll found that more than 8 out of 10 Americans think the U.S. healthcare system either needs fundamental changes or needs to be completely rebuilt. Even 70% of Republicans feel that way.
Sarah Dutton is head of surveys for CBS News. An end-of-July poll showed 2/3 of Americans supporting some sort of public option, although fewer Republicans than Democrats. Where Americans are most ambivalent is over the cost of health care reform.
We can't spend any more money. We've got to stop.
Hot button number 3.
You can't tell us how you're going to pay for this.
You are absolutely right that I can't cover another 46 million people for free. 2/3 of the money we can obtain just from eliminating waste and inefficiencies.
But the Congressional Budget Office has put $1 trillion price tag on health care reform over the next 10 years and calculates it will add $239 billion to the federal deficit. And what happens if health care reform fails?
The Urban Institute estimates that as many as 66 million Americans could be without health insurance in 2019.
That's why the Congress and the President takes this so seriously. There is now, every year, $2.5 trillion spent on health care. This $2.5 trillion will soon be $3.5 trillion, $5 trillion. Our economy cannot sustain it now.
For all the scare tactics out there, what's truly scary is if we don't do anything.
A contest between hope and fear, he called the fight for health care reform. At week's end, with the decibel level still rising, Barack Obama's battle cry had the unmistakable sound of his presidential campaign.
I need your help. I need you to stand for hope. I need you to knock on doors. I need you to spread the word, because we are going to get this done this year. Thank you, Graham Johnson.